I'm talking about myself. Today is my day. Well, Padma Shri Dr. Pradeep Chowbey is a phenomenon by himself. He's a landmark achiever. His all achievements cannot be acknowledged or recounted on a single platform like this. His legacy will continue to inspire innumerable young and budding surgeons all over the country for years to come. We had a very long association. Since laparoscopic surgery started, we have shared hundreds of workshops together because there were very few people to be invited at that time. We have attended conferences together. We have traveled the world together. We have shared the same room in a hotel, and there have been lots of things. And during all that period, I saw Pradeep rising from our level to become an athletic proportion. I'll request Dr. Rashmi Pyasi to read the citation.
Dr. Pradeep Chowbey belongs to the cadre of the pioneer laparoscopic surgeon in India and beyond. He was one of the first to perform laparoscopic cholecystectomy in North India, and since then has worked with singular determination to develop, evaluate and propagate minimal access metabolic and bariatric surgery in India. He is the honorary surgeon to the President of India, honorary surgeon to the Armed Force Medical Services, and surgeon to His Holiness the Dalai Lama. He has been awarded the Padma Shri in 2002 for his dedication and service in the field of minimal access surgery. Dr. Pradeep Chowbey has served various esteemed worldwide associations as the President, including Founder President Asia Pacific Hernia Society, President Asia Pacific Metabolic and Bariatric Surgery Society, President Asia Pacific Chapter of International Federation for the Surgery of Obesity and Metabolic Disorders, Worldwide President International Federation for the Surgery of Obesity and Metabolic Disorders, President Obesity and Metabolic Surgery Society of India, and Trustee and past President Indian Association of Gastrointestinal Surgeons. Dr. Pradeep Chowbey has a record with over 70,000 surgeries to his credit and has featured in the Limca Book of Records continuously from 2000 to 2016 as the first endoscopic surgeon performing most number of minimal access surgeries. Dr. Chowbey, along with the core group of experts, has formulated guidelines and recommendations for hernia, minimal access surgery, and obesity and metabolic surgery. Presently, Dr. Chowbey is the Chairman, Max Institute of Minimal Access, Metabolic and Bariatric Surgery, Chairman, Surgery and Allied Surgical Specialties, and Executive Vice Chairman, Max Healthcare Institute Limited, and at Max Super Specialty Hospital, New Delhi. Under Dr. Chowbey's leadership, Max Institute of Minimal Access, Metabolic and Bariatric Surgery is the first center to be accredited as the Center of Excellence for Metabolic and Bariatric Surgery, Hernia Surgery by the Surgical Review Corporation, USA. The center is also accredited as Center of Excellence in Endo-Hernia Surgery by the Asia Pacific Hernia Society. Dr. Chowbey cherishes the human values of sobriety, humanity, forgiveness, and gratitude. I present to you Dr. Pradeep Chowbey.
On behalf of the organizing committee, I present this citation to Dr. Pradeep Chowbey.
Yes.
Thank you so much. Thank you, sir.
We need your hands up.
Thank you so much. They're never empty for long.
And this is again Professor P.K. Chowbey.
Thank you.
Please. Thank you.
Thank you so much.
I request Pradeep to say a few words.
Good evening, everybody, and thank you very much, Ajay. More than anything, it's an emotional moment for me, and it has been very kind and very generous of Ajay to have said so many good words about our association. Also, our teacher, Dr. Wadia, is here. Our president, Dr. Ramesh, Secretary Sandev, and of course Rashmi, probably who has been the leader of the organizing team under Dr. Kriplani. Well, I think it's a very, very big honor for me to be handed over this memento, and also to be reminded amongst the legends in surgery what the India and the Asian subcontinent have seen. And you have been presented with the senior-most surgeons in the country, and we all are their students. And I know that we try to follow their instructions, their teachings, but still we feel always lacking that the standards which have been created by them, I don't think will be in the near future. Any one of us will be able to reach to those high standards of morality and high standards of passion and honesty which Dr. Sharma just spoke about. I remember meeting in Mumbai with Dr. Wadia. That was my first visit in '93, and since then we have a long relations. Like he has been my mentor throughout and has sort of put me on various platforms. I don't think I would have achieved anything if he would not have been my mentor. Of course, Ajay and myself, we share altogether a different feelings for each other, because we traveled all over the country. We traveled the remote areas of the country, taking the mission of doing a safe laparoscopic surgery and not making it a so-called difficult surgery. And we try to simplify the surgery for all our youngsters, at the same time make it safe. And as Dr. Wadia always mentioned, that it should be affordable. We always try to make it affordable by a little bit of alteration, changes in the method of doing it. And I'm so happy that this honor is coming, of course, from none other than Ajay, who has been very, very closely associated with me in the country and outside country. I remember lots and lots of places in the world. Both of us, we have traveled in those areas, and after the conference we used to spend 1 or 2 days to see the place. Thank you very much. With this emotional note, I wish you all the best for the course. Thank you.